Gracias, Chairperson, and good morning, bon dia. That's the only Portuguese I know, which I'm sure is a bit close to Spanish. And good day to everyone. I'll just shut down my, how do I shut down my video there? Okay, let me move. Today I'm going to be presenting to you, I was asked to talk about a presentation I gave at the ICO conference in Morocco this year. And it's on a number of topics, the prevention culture, the mining industry, and it's from a female perspective. So I will talk about women and it's Africa. So in terms of my presentation, I'll talk about African mining industry. Apologies for that typo. The prevention culture, mining, women in mining, and one South African case study. And then last, so I'm starting from the top, the whole of Africa, and then a little bit about Minerals Council South Africa. I hear, Chairperson, you've already talked quite a bit about it. And just highlight a little bit about our occupational health in South Africa. So if we look at mining in Africa, Africa is currently, it's very well endowed with minerals. And if you look at this graph, the orange is showing you the resource exports over total exports. And countries, for instance, like Cote d'Ivoire, Guinea, Botswana, you've got up to 95%, 86% of their exports being resource, exports. And on the left, you have got the navy, which shows the resource GDP per total GDP. And again, you can see how in those countries I mentioned, up to 14%, 19% in Botswana of their GDP is from resources. And so mining is a huge contributor really to GDP and to exports in African countries. And it's only in South Africa and Tanzania where it's accounting for less than 20% of their resource exports. And it is growing. A lot of the new critical minerals which are being used for the future battery industry, the minerals of the future are found in Africa. And so mining is going to be here for a very long time and is going to expand. Again, just to illustrate the resources that we have, the share of global resources, the platinum group metals, more than 80%, and phosphate again, about 80% of those resources are in Africa. And for the rest, like manganese, cobalt, up to chromium, more than 40% of global resources are in Africa. And so Africa has huge potential, is the message. Now, mining is, as we mostly know, all of us, it's quite a hazardous industry. For instance, the ILO says we employ 1% of the global workforce, but we generate 8% of the fatal accidents. And small-scale mines, their accident rates are even 6 to 7 times higher than in larger operations. And actually, in Africa, a lot of our mining is small-scale mining, which means that, there's huge risk there in terms of injury and disease in the small-scale mining. On occupational diseases, mostly it's noise-induced hearing loss, asbestosis. A lot of African countries are still mining asbestos. Of course, even in Asia, we do find that, and we know the dangers of asbestos, which are not now, but in 30, 40 years, a lot of people suffering from asbestosis, and South Africa is a good example of how we mined asbestosis for a long time, and we actually had to stop in the 2000s when there was large scale, a lot of people had asbestosis and we had to compensate those people. There were class action suits, just like we now have silicosis class action suits and people being paid for diseases that they acquired from, working in the gold mines. We are currently also have that starting in our coal mines, where the lawyers are putting together a class action suit against us, or let me say the companies that were employing those people. Then in the artisanal space, there's a lot of mercury, zinc vapor, and cyanide exposure. So as I said, Africa has a large artisanal scale and small scale mining sector. It's estimated that there's 10 million people and more working in that sector. And if I can just give you a comparison, in South Africa, we have an average of about 500,000 employees. So 10 million and more actually is in the artisanal space, which is a lot of people. And as I said, they are now exposed to all of those, including silicosis. In the ICO conference in Morocco, we heard how there's people who get accelerated silicosis from exposures in artisanal and small-scale mining. And so this is a serious concern. And of course, workers are poorly educated on the risks, on the prevention, and there's minimal occupational health services. If the health services themselves in our countries are challenged, how much more when it comes to occupational health services, which really there's very few countries which invest in those, and most occupational health services on the continent are usually provided by companies. And we also have a lack of regulation in a number of countries, and also a lack of enforcement, especially on artisanal and small-scale miners. So if I can now move on to the prevention culture. Of course, in occupational health is in the prevention space, and that is our mantra. We need to be preventing as much as possible. And, the prevention culture is seen as a mindset, it's an attitude, it's something that a country should be driving, a company should be driving. And if this culture is actually from a country level, from the level of the Department of Labor, Health, Mineral Resources, right down to the company and the employee, then we will make sure that, we protect our employees and ensure that people go home safe every day. As I said, there are several dimensions to the prevention culture. There's at a national level, a workplace level. You also need to be looking at reducing not only workplace related incidents, risks, but also non-workplace related ones. So outside the mine, for instance, road accidents, the mine also needs to say, how do we assist the community, in reducing non-work related accidents, especially when it comes to roads, for instance. Again, it shouldn't be just about accident and work-related diseases. There's also non-communicable diseases, which are a challenge. A worker who is not healthy, has got, let's say, diabetes, hypertension, is not going to be a very productive or safe worker. And therefore, that's why then we now need to move into the wellness space, ensure that our employees are well, because then we'll have less accidents. Again, health protection and promotion and covering all workers. And here the emphasis is on contractors. Our key challenge is when, as companies, we use contractors and we do not treat them as our employees. Then you find that they are very disadvantaged when it comes to even the occupational services sometimes, the compensation. In our country, for instance, we've got different, compensation mechanisms. In the mining industry, most employees are covered by an assurance system, and the rest are on a government offered system, and you find that there are differences there. So we need to try and narrow those differences so that all workers are treated the same. And here we just have, one is showing, the evolution of the prevention culture, which started off concentrating on technology, how we use technology to improve risk, elimination of risks. We then went on to the OHS management systems, and we are now in the phase mainly of the safety culture. There are several occupational health ILO conventions which support the prevention culture, and these are the ones I'm highlighting: Convention 155 and its protocol, and also the Convention 187. And in short, really, these are about ensuring there's a national policy, that provides for continuous improvement on occupational health and safety. Again, the protocol emphasizes the collection of information, because if you cannot manage that which you cannot measure. And I think in mining in South Africa, we have found that it's quite critical, because it shows you where the gaps are if you are collecting data. So data is very important if you are to prevent disease. And the framework emphasizes, the assessment of occupational risks and hazards and combating at source. And the key things that we use in addressing hazards and risks are critical controls, which we also then use bow ties. The critical controls are those controls which are crucial to prevent and prevent or to mitigate the consequences. And the absence of those critical controls will increase the risk despite the existence of other controls. So that's how you differentiate between a critical control and other controls. The critical one is the one which, if it is not there or if it fails, will increase the risk significantly. And again, these controls, they prevent more than one unwanted event, or consequence. Bow ties are just a method, and I'm gonna just show you how. I won't show you how to do bow ties, but I think what is important is that bow ties, where you do your bow ties, is critical. And at the top, you can see there we've got, the normal maturity of companies, from basic to reactive to compliant, which means all you are looking at is, am I complying with the law? That is the middle. And that's where your bow tie will be. And then if you become proactive, then you will do bow ties which are higher in the higher order, which is proactive. And in a resilient organization, you will then also do bow ties which are closest to the hazard. Because as you can see, this is a continuum, starting with the hazard and the consequence. So if your bow tie is addressing consequences, there's already an incident or there's disease already, it means there is a consequence, and you are therefore basic in your approach. And what you should be aspiring to is to be a resilient organization, which means you have your bow ties at the beginning of the hazard. You are preventing the hazard, you are controlling the hazard, so that you then eliminate the outcomes or what will happen if you do not prevent hazards. An example, if you control for dust at the source, then it means you will not have dust, related diseases. The big thing I would like to talk about is women in mining, because women are now entering this field. Just a recap of our journey as women. I think the most critical is in 1935, the first regulation of women working in the mining industry was through the ILO, where they actually had a convention that prevented women from working underground. And over the years, and in fact, there's still about 68 countries which have got that convention in place. But over the years, most countries have denounced the convention, South Africa doing that in 1996, with our democracy in 1994 and the new Mine Health and Safety Act. It then meant women can work anywhere. And actually in 2018, the ILO itself classified that convention as outdated. So currently we have global estimates of women in mining being between 8 and 17%. averaging about 12%, but actually in the artisanal and small scale mining, there's far higher levels of women there at about 30%. In South Africa, for instance, we are now on about 18%, 16%, and some companies up to 20%, or some commodities up to 20% are women. And of course, with modernization, there'll be more women. What sometimes inhibits or prevents our full participation is the nature of work that is done. For instance, if the work is very physical, then it means women will fail tests, the physical work capacity tests to work in those workplaces. But as we all know, there's modernization, which means there's more women who will be entering the industry. These are some of the challenges that women experience: discrimination on many grounds, being less valued, sexual violence, rape, even murder, sexual exchanges for work, and the workplaces not being adjusted for women, things like ablutions, toilets, the PPE, pregnancy and lactation, physical capacity, as I mentioned, and the physiological differences, and women's health, which is something that is not yet catered for adequately. These are some of the the ways in which we can address the challenges for women in mining. On the government side, ensuring that we ratify conventions, that eliminate discrimination against women. We also have Convention 190 and Recommendation 206, which are on elimination of violence and harassment, policies on women in mining, and generally recognizing, that women are there to stay, and ensuring that you have those policies in place. As employers, again, the policies, women-specific OHS policies are essential, women's health, and culture transformation and employee education, because when new people get into any environment, you need to educate the ones who are there so that they are able to accept them. So the WIM programs need to take both men and women into account in terms of educating both sides, so that the one side accepts that women are there and they need to respect them. And for unions and employees, it's mainly education, promotion of equality, and lobbying for improvements. There's a lot that still needs to be improved when it comes to the working environment of women. And I think unions and employees are also important in ensuring that they do highlight the gaps that are still there and holding governments and employers accountable. So if I can just briefly talk to the South African case study, I will not mention everything. I think my time is, I don't have too much time left. So as I said, in 1994, then women were allowed to work underground, although the legislation was in 1996. And we then had a culture transformation framework in 2011 as a tripartite. We have a Mine Health and Safety Council, which has the tripartite, and the culture transformation framework recognized that we need to eliminate discrimination, women, race, all forms of discrimination. So that's our foundation for women, being accepted in the industry. We've had a lot of research. I will not mention all the research that we have had, but I think most significantly in 2020, we then, through that Mine Health and Safety Council, established an advisory committee on women in mining. And there's a lot that they have now been pushing. And one example is a guide which has been work that has been undertaken through the Mine Health and Safety Council, is a guideline on PPE for women. And this guideline was first issued in 2015 and was reissued last year. And it guides companies on what they should do to provide PPE which is suitable for women. I think in summary, just to say that mining contributes a lot in Africa, and women are participating. and it's a high-risk industry, and the prevention culture is essential if we are to manage the hazards that we have. We do, women present a special challenge, and we need to cater for them. And of course, there's many case studies we can learn from other countries, and Africa needs to improve the collection of data. And last, the future of mining is more females, and therefore we need to do more. Last, I'm gonna just touch a bit on South Africa, which is Minerals Council South Africa. The chair introduced us very well, so I will not say anything. We are like a chamber of mines. If you know what a chamber of mines is, then that's the Minerals Council. We have 70 members who account for 90% of mineral production in South Africa and about 80% of employees. In South Africa, we, in 2023, had about 479,000 employees. We sort of fluctuate around 500,000 over the years. And we contributed 440 billion rands to the GDP and 85 billion in terms of tax. These are the diseases that we have in South Africa, mainly noise-induced hearing loss, TB, silicosis. The top blue is the total diseases. And I think one just wanted to show how we have improved. If you talk rates, as I said, we fluctuate, you know, I would say between the highest number for this period, 2008 up to 2022, we've got a fluctuation of about 20% in terms of employee numbers. But on average, you know, the fluctuation is not very wide. I'm saying that because it's important to be comparing rates rather than numbers. And these are numbers, what I'm putting before you. So the total, as you can see, TB in red used to drive a lot of what was our total number of diseases, which is in blue. And we, at one point, had about more than 4,000 cases of TB in a year, and we're now down to about less than 1,000. The yellow is silicosis, which is really still a challenge. In the past 3 years, we've been reporting, I would say, more than 200 cases per year of new people that have developed silicosis. So there is still a lot of work to be done. Again, the green is noise-induced hearing loss. And actually, we have had the least progress with noise-induced hearing loss. The other diseases have reduced in the orders of about 80%, but noise-induced hearing loss has decreased by about 55% over the same period. And as you can see, it's sort of leveling out, and it would be great to hear from colleagues really what more we can do around noise-induced hearing loss, because mining has a lot of noisy machinery. And here I'm just showing you the source. For instance, here it's our crystalline silica graph, which we have a milestone. Our current statutory occupational exposure limit for crystalline silica dust is 0.1 milligrams per cubic meter, but we have per square meter, cubic meter. But we actually had a milestone or a target as an industry that we set in 2014 that let's try to achieve half of that. And if you look at, you know, the blue graph, that is how we were supposed to move per year if we were to achieve the target. And the bars show where we are, which is the target was 5% by this year, 2024, and we haven't quite reached that target. We are floating around 6%, but we think we have done well considering where we come from, which was about 16%, 9%. So we have made some progress, although if you look at the gold sector, it is still on about 12% on its own. Again, the last exposure I'm showing you is noise. Noise is a huge challenge for us. The red is people who are exposed at more than 107 decibels. The yellow is between 85 and 107 decibels. And the green is people who are below 85 decibels. And so you can see that we've got this large number of people who are still exposed at more than 85 decibels. And the wearing of hearing protection devices is in humid and very hot conditions is a challenge, which is why our noise-induced hearing loss has not yet come down the way it should. So in summary, and my last slide, disease rates in our country, they have come down over time, but with slower reductions in noise-induced hearing loss. We still have significant numbers of employees with silicosis, noise-induced hearing loss, coal workers pneumoconiosis, which I didn't show you, but we still have, even though it's much lower numbers, you're talking less than, 50 most times per year, it's still significant. And another, I didn't show you the TB rates, but our TB rates have come down markedly. We are now below the South African TB rate in terms of incidence, although our gold sector has not yet, achieved that target. The silica dust levels have declined over time. Noise exposures are still high. And overall, we are saying the elimination of exposures is a priority for us if we are to prevent disease. Gracias. Thank you very much.